If you don't know who I am, please, it's 100% by me. On behalf of Bestmed, we really hope that you will enjoy today's session.
What does Bestmed do to make an impact on the bottom line of their corporate clients? And we trace that back to the productivity component and the influence that healthcare has on productivity. It's a complex and large topic, but the speakers today, we had actuarial input, we had medical input, and we had human rights input. Was absolutely fascinating, and the whole day is around the birth of a new movement around taking corporate citizenship, taking responsibility, and illustrating how quality healthcare has got a direct correlation to increased productivity, and that's really what it's all about today. Is Bestmed is saying, guys, let's get together. We need to do something in the country. We are a competitive economy. We can be much more competitive, and let's just do some small, simple things like addressing obesity in the workplace. And we're convinced that it's going to have a massive knock-on effect.
The thing that we have in common, Bestmed, with the employer, is that individual. That individual is our member. That individual is your employee. And if we work together, we can actually do something that benefits both of us. What's in it for us? If in the end we manage to improve the health of this individual, the claims pattern will change, which means our premium increases will be lower, which means everybody will be happy. It also means that that individual will be more productive. Less absenteeism, less presenteeism, and we have a good outcome for both. And that's where we are heading. That's what we are aiming for. If you know the Cochrane database, it's a worldwide database where they look, when they do a meta-analysis, they take all the research on a topic and they analyze it, and they come up with suggestions and with an analysis on the risk. And they say that presenteeism, that thing sitting at your desk and not being there, they've identified the risk factors for presenteeism. Number 1, inactivity. Number 2, poor eating habits. Number 3, stress. So if you can address that, then at least you're having an impact on the presenteeism. And the one message probably for all employers would be that management drives the cultural change process in an organization.
Ladies and gentlemen, I tried to put to you the issue of internationalism. I tried to put to you the relevance of business in the whole exercise. I'd like to encourage you to become part of the UN Global Compact, to become part, not stepping out of your own business, but really realize the natural fit between what you stand for and how you create a sustainable future. And in the end, I would like to say that you are part of the South African Constitution, you are part of the Bill of Rights, and you are part of building this difficult new nation. Thank you very much.
What's interesting is intuitively we think the more you pay, the better product you get. High quality and high cost goes together. In healthcare, the opposite is often true. So there's a very clear opportunity for a win-win in healthcare, because quite often the highest quality doctors and specialists and providers actually operate at a lower cost. Why? Because you go to a hospital, you're out of hospital within 2 days. If something went wrong, you go to ICU, which costs a lot of money. You'd stay there for 10 days, or you have to come back later to have the hip replacement redone. So in healthcare, there's this fascinating potential win-win where high-quality healthcare actually costs less and not more the way you might intuitively think. And there's a lot of interesting calculations that make my profession very excited about doing the right kind of risk adjustment, because an employer dealing with older people or older employees will have different results than one dealing with younger ones or males and females, etc. And that's where actuaries get quite excited because we know how to fix and adjust for those things. And there are wonderful visualization tools that allow an employer to explore the data and look at how these things interrelate and generate reports that will ultimately show that maybe there is a business case after all when you look at the whole picture, at this kind of picture. And maybe that's what I want to leave with you today. Wellness is not as simple. All of us agree it's the right thing to do, but to get to the business case, a much, much closer intersection between the employer and the medical scheme is required. And I'm quite excited to see Bestmed starting to talk about some of these ideas. I'm quite excited to see more and more employers with the fourth bottom line kind of regime also starting to talk about those ideas. So really, that's what I wanted to share with you. The question as to how to take this forward, just in one sentence, requires cooperation. Getting around the table, I'm particularly fond of this quote. Henry Ford said, "Coming together is a beginning." So Chris, this is probably like a beginning today. Keeping together is progress, and working together is success. And this is from Henry Ford. So thank you very much for the opportunity.
Thank you. The Captains of Industry Symposium, which today we had the inaugural event, and we aim to have that an annual event, arised out of this time of the year. It's September. We engage a lot with employer organizations and captains of industry specific. And I personally was taken aback about how the captains of industry that we deal with has got an absolute passion to improve their employees and their work environment for a better productivity scenario. I think one of the big influences around it is Tony Hish, the CEO of Zappos.com, that created a happiness movement, and it sounds a little bit fickle, but he illustrated very successfully how happiness is the pathway to profits. And we've been doing research over the last 2 years around corporate cultures that is more happy corporate cultures is more profitable. So that thought was taken up by the Captains of Industry, and if I refer to Captains of Industry, obviously within the Bestmed employer environment, the major decision takers there, and we hope to take it into Captains of Industry not only within the Bestmed environment but in South Africa as a whole, and even in Africa there's a huge role to play around corporate decision makers, or the captains as we refer to them.
We had a lot of thinking around what it is that we want to do and what it is that we wanted to achieve, what the outcome should be of getting a number of people together. I think we were clear from the start that it had to cover different disciplines and different areas of just business, and not necessarily just be on medical schemes. In order for us to start stimulating conversation that is more acceptable almost in the broader South African perspective. And with the result, when we actually sat down, we realized that, there always is a political side, especially to health as well. And then, of course, needing to understand what it is that you actually do within medical schemes, starting off with Chris doing the wellness platform of understanding that medical schemes are there to take care of your health, and also what your role is in terms of taking care of yourself. And then then we investigated a number of other people that we should look at in terms of speaking in a broader South African perspective. And we came across the Human Rights Commission, and Dr. Danny Titus was a member of Bestmed for a number of years when he was professor at UNISA. And just understanding what his message is and his understanding of what people's rights are came across quite clearly. And we could see that these things are starting to tie up, There's a message in it from a wellness perspective to health, to understanding what human rights are. And collaborating all this into a speech by Christoph, Christoph just understanding the industry, understanding the impact of condition treatment, disease treatment, and how diseases are evolving in South Africa as well, just made the picture, completed the picture. And that is how it all came about.
And if I may leave something with you again, perhaps this is something that this meeting may consider. A business leaders initiative on human rights. A business leaders forum where we can discuss these things with each other in a calm, collected way, integrate the Ruggie principles, test the testing areas, because it's not always as easy as always tension as well, but it doesn't need to be tension. I leave that for a while with you.